such a beautiful day for a nature walk.
I know, the flowers and all the trees. It really takes my mind off the back pain.
Speaking of which, how many weeks till you're due?
3 weeks. That's what my gynecologist said.
That's so cool. What are you thinking of naming her?
We were gonna name our kids Lily or Eve, but we got boys.
Aww. Well, we were thinking,
What's wrong? Are you okay?
No, I just got a really bad back pain and pain in my abdomen.
Oh my god, I think your water just broke.
In this scenario, Shania is going into labor. Due to the circumstances, she cannot get into the hospital. Therefore, they must all take action and utilize their resources to the best of their ability in order to make the delivery of the baby the safest it can possibly be.
In this video, we will explain each step that one should take to deliver a baby in an emergency setting. The most important thing to remember is the safety of both the mother and the child. Additionally, staying calm and keeping the mother relaxed will help make the birth easiest as possible.
The time each birth takes varies from woman to woman. However, each woman will go through the 3 stages of birth.
The first stage is when the womb contracts by itself to open and bring the baby down to the birth canal.
The second stage is when the mother pushes with the contractions of the womb to help the baby through the birth canal and out into the world.
The third stage is when the afterbirth is expelled.
Sometimes it is difficult whether to tell if the mother is actually going into labor or she is simply experiencing non-labor related contractions. Contractions are defined as a shortening of the uterine muscles occurring at intervals before and during childbirth.
The signs and symptoms of a woman going into labor would be if it feels that the baby has dropped or is sliding down the pelvis, if there's strong or rhythmic contractions numbering more than 6 an hour, if her water breaks, if she has lower back pain, bloody vaginal discharge, or diarrhea and nausea.
Contractions should be approximately every 5 to 10 minutes at a constant rate for 1 or 2 hours if they are labor related. Unlike true labor, false contractions are usually felt in the front of the body in the lower abdomen and are typically weak in strength and may stop when a woman walks, rests, or changes position. Also, the time between contractions does not decrease as it does with true labor.
Childbirth is a common occurrence most people will experience either firsthand or as an audience member. Either way, it is important for everyone to know the basic steps of emergency childbirth, so if the paramedics can't come in time, the child can still be delivered safely.
We will now outline the process step by step along with our visual representation.
The first step is to check that the scene is safe before proceeding.
Then call 911, inform them of the patient's name, how long the contractions have been occurring, and if it's her first birth.
Take out the emergency medical kit and lay blankets on the floor.
From the blankets, pull her pants down and spread her legs apart.
Make sure to support her head using whatever you can find.
Put on the proper PPE before continuing. Something to remember is that you want to reduce the possibility of infection and should not touch the vagina at any time.
It is important to time the contractions to assess how the birth is progressing.
Do this by placing a hand on the woman's belly button. As a contraction begins, you should feel a hardening ball, and when it relaxes, the contraction has ended.
Count how long each contraction is, as well as the lengths of the gaps in between. This way, the mother will be able to prepare for the next contraction.
Additionally, as the labor progresses, the time in between contractions will decrease gradually. If the mother is comfortable, she can stand up as that induces labor.
Throughout the whole process, constantly reassure the mother. Oftentimes, she will be irritable, which is why it is best to push away onlookers and help her focus on her breathing.
The baby's head will initially only be visible during contractions. However, when the head reaches the outlet of the birth canal, their head will be visible at all times.
The mother will now experience a stretching, burning sensation. She should no longer push during contractions and try to avoid this. She should try and pant like a dog on a hot day. This will allow the baby's head to slide gently and painlessly out of the canal. This will prevent the mother's skin from ripping and will reduce possible trauma to the baby's head. It is important that the mother pant instead of pushing until both the baby's shoulders and head have emerged.
Once the baby's shoulders have emerged, take a sterile gauze pad and support the baby's head. Do not pull quickly, as this will cause tearing of the vagina. Make sure the baby's head is not in a puddle of amniotic fluid. At this time, check to make sure the umbilical cord is not tangled around the baby's neck and untangle if necessary. If one of the shoulders has not emerged after many contractions, hook 2 fingers inside the vagina and feel for the armpit. Pull the other shoulder up by the armpit and proceed.
The baby's head emerges, it is usually face down. It then turns so that the nose is turned towards the mother's thigh. Support the baby's head by holding it in your hands, but make sure not to pull or exert any pressure. Help the shoulders out, and as they emerge, be prepared for the rest of the body to come quickly. Try to use a clean towel to hold the baby.
Then with one hand, grab the baby at the ankles and support the shoulders with the thumb and middle finger around its neck and the forefinger on the head with the other hand. Make sure not to pull on the umbilical cord when picking up the baby. Lift the baby's body slightly higher than the head so that the mucus and other fluids can drain from its nose and mouth.
Note the time and approximate the location of the baby's birth. The baby will probably breathe and cry almost immediately. If the baby does not, gently clear the mouth of any mucus and stimulate them by rubbing their back or tickling their foot. If they are unresponsive, begin infant CPR.
The mother will probably want to hold the baby, so if the umbilical cord is long enough, let her. If the cord is too short, support the baby on the mother's abdomen and help her hold it there. It is beneficial to the baby and makes the afterbirth come with less bleeding if the baby can be allowed to suckle at the breast as soon as it is born. However, it is extremely important that the cord should not be cut until the afterbirth has been completely expelled.
If hemorrhaging occurs, the uterus should be gently massaged to keep it firm. Her legs should be elevated and she should nurse since it stimulates uterine contractions. If the mother goes into shock, treat her for shock by keeping her warm and reassuring her.
The baby has risk of infection from cutting the cord, so it should not be done until sterile conditions are available. If there can be medical help within a few hours, do not cut the cord and leave it and the afterbirth attached to the baby. However, if there will be no medical help, wait until the afterbirth is out, or until the cord is whitened and empty of blood. The cord should not be cut until it quits pulsating, since the baby is still receiving oxygen from its mother.
As the placenta separates from the uterus, the cord will appear longer. Grasp gently and rotate it clockwise. Then tie the cord about 6 inches from the baby, and then tie a second knot 2 inches away from that. Use a tight string to tie off the cord. Use scissors to cut the cord, but make sure to sterilize first with alcohol wipes.
Make sure to continually check the vitals of the mother and the baby. Wait with them until medical personnel arrive.
We hope this tutorial helped explain the basics of how to treat an emergency childbirth and will help you if you're ever in a situation where you may have to deliver a baby.
Almost all emergency births are normal. The babies usually thrive and the mothers recover quickly. It is necessary when assisting with an emergency delivery that you continually reassure the mother and attempt to keep her calm. It is most important to remember that you should mainly let nature take place ultimately. Childbirth is a natural act and it should not be feared.